Hi, good afternoon. Today we'll be presenting post-traumatic stress disorder in veterans, done by Caitlin Alsi, Elian Borrero, Alex Robles, Alyssa Hernandez, Christine Fields, Amy, and Defina Fortune.
Hi, my name is Caitlin Elsie, and I'm going to be telling you about my slide, the wars most related to post traumatic stress disorder, PTSD. So, PTSD can happen to soldiers who have been in any war, but some wars are more likely to cause it because of how intense the fighting was and how many scary things the soldiers saw. So, for example, the Vietnam War, veterans have a higher likelihood of experiencing PTSD compared to other veterans due to their extended and intense compact exposure, as well as the difficulties they encountered when returning back home. They faced rejection and a lack of support. And then for Iraq and Afghanistan, veterans who served in Iraq and Afghanistan, commonly known as the post 9/11 conflict, have unfortunately faced elevated levels of PTSD. Um, the wars necessitated extended deployments, exposed to the guerrilla warfare, and frequent encounters with improvised explosive devices, resulting in imperishable psychological distress. And then the last one is the Korean War, I put. So it is worth noting that even veterans from World War II and the Korean War may experience PTSD, although it may not have been as widely acknowledged or comprehended during the time period. The prolonged and intense combat scenarios in these wars likely played a significant role in the manifestation of PTSD symptoms among many veterans.
The incidence of PTSD is more common in veterans than in regular civilians due to them being on the front line and being exposed to different traumatic events than civilians. The war they may have served in may also affect their risk because of the types of trauma that were common, whether it be horrible and life threatening experiences or a serious training accident. The prevalence of PTSD is slightly more common among veterans than civilians. According to statistics, 7 out of every 100 veterans will have PTSD compared to civilians that have a lower prevalence among their numbers. According to the data collected for PTSD varies by service era from a large study of veterans in the past year. During the Persian Gulf War Desert Storm, 14% of people developed PTSD. For the Vietnam War, 5% of veterans developed PTSD. For the Afghanistan and Iraq wars, 15% of veterans developed PTSD. And due to World War II and the Korean War, 2% of veterans in the past year have developed PTSD as a result.
Okay, so for mortality and morbidity, starting with morbidity, um, veterans have an increased risk of cancer, diabetes, neurodegeneration, GI disease, autoimmune disorders, and just a lower overall physical health. And that's because they engage more often in self-destructive behaviors, just because in the military it's a little bit more extreme. They're put under constant stress by their supervisors if they're ever in combat, especially. As well, 90% of individuals with PTSD will have other mental health disorders, and that just comes from the background of what they experience in being in the military, or if they even had mental health disorders prior to joining. They as well may experience social phobias, psychotic symptoms, OCD, agoraphobia, which is fear of being in crowded places, and panic disorders, and as well anxiety, generalized anxiety disorder. And they are highly likely to engage in alcohol and substance misuse slash dependency just because it's more common in the culture. Um, and for mortality, 47% increase of it, with a 32% increased risk of death. Veterans are at 57% higher risk of suicide than those who never served. In 2021, 18 veterans died per day due to suicide. Suicide rate is highest 3 years after discharge at 33%. Discharge meaning after they leave the service and they're no longer military members, but veterans or and they just transition back to the civilian life. And 30% for deployed veterans for their suicide rate. And for the population with the highest amount of suicide is junior enlisted Army Marine veterans. And that population specifically tends to be more in the younger side. Those those are the ones you see more common in like that are fresh out of high school, around like 18 to 22 years of age. And they're just new, like still adapting to the way of life in the military.
One major assessment finding related to PTSD is re experiencing, in which the patient describes feeling as though they are reliving the traumatic event. Symptoms of this include nightmares, flashbacks, and intrusive thoughts related to the event. Another major assessment finding is avoidance, in which the patient avoids places, people, or situations that remind them of the traumatic experience. There are two nursing interventions that would be beneficial for veterans with PTSD. The first one would be psychotherapy, such as cognitive behavioral therapy and prolonged exposure therapy. The second would be medication, such as selective serotonin reuptake inhibitors and serotonin norepinephrine reuptake inhibitors.
PTSD has a tremendous influence on veterans' life, affecting their mental health, relationships, everyday activities, and overall well being. Participating in a project on PTSD among veterans changed our perspectives significantly. Initially, we underestimated the incidence and severity of PTSD, believing that the available resources would be sufficient for veterans to manage the condition. However, conducting research refuted these beliefs. Their testimonies within the article shed light on the widespread impact of post traumatic stress disorder, as well as structural barriers to healthcare access.
Our understanding grew beyond PTSD to include wider concerns like stigma, access to care, and socioeconomic inequality. This understanding highlighted the importance of comprehensive approaches to veteran care that go beyond addressing PTSD symptoms. We got a deeper appreciation for veterans' perseverance and realized the significance of comprehensive support networks. Overall, this project has changed our ideas and attitudes, pushing us to approach nursing with a better awareness of veteran health challenges and a desire to make a difference. We hope to improve the well being of veterans via education, advocacy, and compassionate care.